Whipple's disease is a is, is a disorder that you usually read about when you're talking about malabsorption syndrome. But in general, Whipple's disease is not to be taken as a malabsorption syndrome alone because it is a systemic disorder. So whenever you think about Whipple's disease, think of it as a systemic disorder, like you have rheumatoid arthritis. Now, when I say that it is a systemic disorder, a lot of the difficult questions that you get from Whipple's disease and a lot of case-based scenarios where you'll not be able to identify the Whipple's disease, that will become very easy. That will, because usually it's very subtle, and people tell you that Whipple's disease is associated with malabsorption, and you never think of Whipple's disease when they try to simply tweak the question a little bit. So the idea will be that Whipple's disease has to be considered as a disorder which is systemic by you. What do I mean? If this is you and this is your body, you have this infection by this bug which is called as Triphorema whippleyi. And forgive me for the spelling, you can check it on Google or any other resource. But this is a bacteria, Triphorema whippleyi, which is an intracellular bacteria. It is PAS positive. PAS positive meaning this is a stain. So it is like it's like a colored water. And if you pour this water, this colored water, pink colored water on Triphorema whippleyi, this bacteria will take up this color and it will become PAS stained. Very, very important, it is gram positive. So it's not just PAS positive, it is also gram positive. So sometimes they can give you a question which of the following is true about, all of the following are true about Whipple's disease except, and the answer they would put very subtly it's a gram negative bacteria, and you would be not able to pick up that answer. So remember, it's a gram positive bacteria, not a gram negative one. Apart from that, this bacteria colonizes itself in the gut, in the macrophages. When I say it is an intracellular bacteria, what cell it lives in, that can be a question, and it lives in macrophages of the gut. So here you have this PAS positive bacteria, and this is going to cause all the symptoms of malabsorption, bloating, diarrhea, steatorrhea, all that crap that you read about in any malabsorption syndrome. And then you can have neurological. Now why are we calling it systemic disorders? Because you can have neurological signs in this. Now, some of the neurological signs can be because of the vitamin deficiencies, the nutritional deficiency that you'll be having, because you're having malabsorption, meaning you're losing all the nutrition. What does it mean? That you might have peripheral neuropathies and stuff, and that will be explained on the basis of malnutrition. But this bacteria itself goes in the blood and it affects the brain. It can cause dementia. That is, the patient might come to you with forgetfulness. And this is the first thing that you read about. Then it can also cause arthralgias, meaning joint pains, and they are migratory. Today you'll be having wrist pain, tomorrow you'll be having some other pain. And the third thing it can cause is going to be your CVS, cardiovascular system. The most important valve that is affected is aortic valve, and you have the aortic valve, regurgitation, and different types of lesions. They also tend to ask you, how do you diagnose Triphorema whippleyi? If there's a good question on Whipple's disease, that will be on the base of diagnosis. Let's talk about it. So diagnosis. So this is the simple diagnostic algorithm that you use. So the patient will present to you with symptoms of Whipple's disease. It could range from simple malabsorption to all the symptoms I've told you. The patient could come with forgetfulness, arthralgia, and anything basically. And when the patient comes to you, what you do is you do a PAS staining, and for the PAS staining you take a duodenal or a jejunal tissue, and if it is PAS negative, Whipple's disease is less likely, but you will never rule out just from the PAS positivity or PAS negativity. If it is PAS positive, Whipple's disease is very probable. Now, if you see here, they have not mentioned whether you have to rule it out if it is negative, or you have to diagnose it. This is the first test that you do. So this is the first test you do, and the next test is going to be an immunohistochemistry or PCR. And when this second test you'll take these two tests. And if both the two tests are positive, if you have 2 on 2, that is the diagnosis of Whipple's disease. If you have one of these two tests positive, meaning if you, let's say if you have past positivity but second test is negative, that is any of the one is positive, then you have to go for a third test, and the third test is actually based on where what is the next manifestation you're having, meaning ki if you also happen to have seizures or any other manifestations, neurological manifestations, you'll take the CSF, and on that you'll do the immunohistochemistry. If you have arthralgias, you'll aspirate the joint, and there you'll do immunohistochemistry. And if the third test is positive, again your Whipple's is confirmed. So let's see. Two tests are negative, it is exclusion of Whipple. So the Whipple's is not there. Third test in case of doubt. And when do you do the third test? When one of them is, when you have 1 out of 2 positive. And in that, if any extra intestinal symptom is there, you'll take the fluid out of that and then you will test it. If you have both of them positive, there is a diagnosis which is confirmed of Whipple's disease. So the simple diagnostic algorithm you must understand is, if both the tests are positive, it is confirmed Whipple. If one of them is negative, you go for a third test, and which is aspiration of either CSF or the joint space. Coming to the treatment part of Whipple's disease, so treatment again is important for Whipple. So this is the slide that you have on treatment of Whipple's disease. I would ask you not to pay attention to this fussy treatment profile. Just know that you start the patient on ceftriaxone. So you start the patient on ceftriaxone, and once you have started the patient on ceftriaxone, you have to give this ceftriaxone for a short period of time, that is as long as this thing is there. And then you for the next 1 year, after this short duration, you have to put the patient on cotrimoxazole, that is cotrimoxazole, for 1 year. If the patient is allergic, you have to put the patient on doxycycline. So this much, if you remember, that is more than enough. But let's see, doxy and hydroxychloroquine. Okay, so doxycycline and hydroxychloroquine for 12 months, that is 1 year, followed lifetime treatment of doxycycline. This is not important. You don't have to give a lifetime treatment. Not important. And this is usually not important. Forget about this slide. Just know you start the patient on ceftriaxone when the patient is having severe symptoms. Once the symptoms have subsided, you put the patient on 1 year of cotrimoxazole or doxycycline. And that ends your discussion on Whipple's disease. Thank you.